Hi, students. How you doing? Dr. Tony here again to continue from where we left off in our PowerPoint series on the family and trauma. If you haven't reviewed part one, I would really encourage you to please go into the forum and look at part one and review part one. In that, we defined what trauma is and complex trauma. We took a little look at that. We then took a look at the family system and what the family system is about and how that works and how that interacts, and hopefully some ideas on how to treat that system. Look at that system a little differently. We looked at functions, functional dysfunctions, how that works within the system. And we also took a look at certain therapy techniques. I encourage you at this point to start to consider in this class doing a little bit more research for yourself. Again, this is up to you, not an assignment, but just an encouragement for you to do a little bit more research and take a look at the different theorists. Okay, pick one, that you like, and stay with that theorist. Learn that theorist techniques. For example, when I was studying for my doctorate in marriage and family, I really like Sal Minuchin. And I do a lot of my family work with using Sal Minuchin's theories on boundaries and interconnectedness and things of that nature. So you may like him, you may like Haley Madonnas, you may like Whitaker, whoever. Just take a look, study that person. Down the road, if I have you for theories and practice, I'm going to ask you to do the same thing for a theoretical basis. Cognitive behavioral, Rogerian, whatever it may be, CBT, REBT, DBT, it's up to you. But the key to being a good clinician and a good therapist is to pick a theoretical basis so that you have a starting point. Eclecticism is not a theoretical basis. Okay? Eclecticism is this. Oh, I've got an idea. Let me get this one. Oh, there's another idea. Oh, I got this one. And you use it on your patients. And what happens a lot of times, you screw up your patients. You don't know what you're doing. Okay? So what you want to do is you want to pick a theoretical basis, something that you like. And once you do that, practice it in your clinical settings. Okay. The last part was the impact of crisis and the impact of trauma and complex trauma with the AOD patient within the family system. Now, remember, um, when the identified patient comes to you or is brought to you by the family system, I want you to keep this in mind, that the identified patient carries the pathology of the system. Now, the identified patient may be for real that part of the family system that is pretty messed up and needs the most treatment. However, if you pursue the patient, if you look at the patient and talk to the patient, that identified patient, if you sequester the family in one section and you have the patient in front of you here, that patient may be able to tell you exactly what they're going through metaphorically uh, as to what the family dynamic is within that system. So when you treat the patient, the identified patient, actually you're treating the entire system. Remember also what I said, that if one part of the system changes, the entire system changes. If one part of the system does not change, then that system just falls apart and it obliterates, and the pathology continues. Now, pathologies can be intergenerational. In fact, most of the time they are. If you remember from your addiction studies, when you first discovered that addiction was a disease, besides it being a brain disease, studies have shown that addiction can be traced genealogically. So if we go back, let's say 3 generations, okay, grandparents, great grandparents, you trace it down that way, you may find out that one of your great grandparents was an alcoholic or a drug addict. And then when it comes to your grandparents, maybe one of those was an alcoholic or a drug addict on either side, mom or dad or both, right? And then maybe in third generation, you're going to find that some of your brothers and sisters may not be addicts, but maybe you, or maybe vice versa. Your brothers and sisters are addicts, but you are not. Okay, that's called skipping a generation. If all of a sudden we see a flow of addiction, and all of a sudden in one generation there are no addictions, that's skipping a generation. But then if you go to the following generation, addiction may occur again. Okay, so By looking at this study, we could sit there and say, yes, it is a brain disease because the genetic component is in there. And as we take a look at the genetic compositions of the RNA, ribonucleic acids, and DNA, deoxyribonucleic acids, the genetic format, we can see the chromosomal structure within it can have the possibilities of traceable addiction in the genes. Okay, just like any type of illness, for example, some families have really bad allergies. Well, maybe somebody in the family has no allergies to anything. Well, that's a generational skip. Okay. So just keep that in mind. So let me share the screen with you and let's start working on part two for this week. This is week two of um, your family systems. So let me go to, let's see how this works, slideshow, and let's go to current slide. All right. So let's talk today a little bit about the approaches to therapy. So what are we talking about? We talk about approaches to therapy. Well, when a patient comes to you, identified or within the family system, mom and dad brings the son or daughter to you and starts blaming the son or daughter for disrupting the family system. Okay, and we have conflict within the system, and we have conflict within the session. Right? What is your approach going to be to that patient? Well, there are basically two ways of approaching this. Um, uh, Concepts. Uh, One is to take a look at denial. And I'm not talking about the river in Egypt. Yeah, I know it's an old joke. But denial is a very big thing. Who is denying what? Now, the parents can sit there and put blame on the identified patient. And as you study the identified patient, you find out that that kid or that parent or whoever they're blaming is being blamed. And their actions, their addiction is quite appropriate for what they're going through. I'm not saying it's the right thing. Addiction is not the right thing, but it's the appropriate thing. What do I mean by that? If I don't have appropriate coping skills, if I don't realize that their issues are their issues and my issues are my issues, and I can't separate them and they're what's called enmeshed or tied together like this, okay? If they're enmeshed, then what winds up happening is that system in and of itself gets extremely, extremely dysfunctional. And as it gets dysfunctional, the system gets enmeshed, and you really can't tell the difference between who's got the pathology and who doesn't. Okay. So all of a sudden, let's say the parents are carrying pathology that's projected onto the identified patient, and they're blaming that patient. Well, they're sitting there and they're in denial. They're not looking at themselves and saying, "Well, I'm part of this screwed up system." They're blaming everything on that patient. The other thing is something called resistance. Resistance is usually presented by the client. Now, resistance is a funny beast. It's a funny animal. Resistance is there because of shame, number one. Resistance is there because of the trauma, and they don't want to re examine or relook at the trauma because they believe that it will traumatize them more. Resistance is there because they feel that if they say anything to you, it's going to be reported. So they may not really understand the issue of confidentiality in the therapeutic milieu. Okay. At which point you may need to re-explain that again and just tell them exactly what's going on. Yeah, everything is with what you say to me is confidential, with the exception if you tell me anything about child abuse, elder abuse, sexual abuse, right? All the Tarasov stuff. If you keep clarifying that for the person and you join with the patient, resistance has a tendency to decrease. However, resistance is also a defense mechanism. And part of resistance can be in the unconscious. And that resistance can be in the form of an unconscious protector known as dissociation. And with complex trauma, we see a great deal of dissociation in there. In fact, that's one of the part and parcels of complex trauma. One of it also sociologically, as we will talk about, if we have not already, my wife did she's an expert in trauma. She's a psychiatrist. She's an expert in trauma. And in fact, that's where this PowerPoint presentation came from one of her publications. And in our discussions, one of the things that we talked about is sociologically, this is the minority population, right? And one of the things that we're not seeing in the family system is the idea that slavery way back when had a main problem, and as we all know, but it has a main problem within the present system, both sociologically in society, because of denial and the propagation, continued propagation of racism within society, called institutionalized racism. So her and her colleagues are trying to make a push in the next DSM to have something, I believe she calls it, and don't quote me on this because I can be wrong, but I believe she calls it post-traumatic slave syndrome. Yes, post-traumatic slave syndrome. This basically is a theory, as I understand it, where ethnically the Black population, the African American population, are traumatized because of the ancestry and the ancestral issues that the white people, the white population, put them on in during slave times, and that goes way back. So that can also play into resistance and denial. As we look at substance abuse, many substance abuse counselors try to base their understanding of a family relationship to on a disease model, which is a good thing. Right? We understand it as a brain disease, right? Within this model, you and me, we practitioners, appreciate substance abuse as a family disease. We have learned that it is a family disease, as I've been trying to teach you, right? So as we take a look at this, the identified patient carries the pathology of the family, but the entire family system is pathological and function within that realm of addiction functionally, which I call a functional dysfunction. It works for them in any way, shape, or form, either to perpetuate the addiction or to blame because I don't want to look at my issues. But so long as the person stays within their addiction, I can look at them and blame them and not look at myself. That's part of projection, right? And that's also part of blaming and shaming. So it's a disease. It affects all members of the family. And because of this, because of one or more members, you got to understand that substance abuse creates a negative change in the individual's mood, their behaviors, their relationships within the family system. And sometimes it can even affect them physically and emotionally. Depressions, suicidality, um, repetitive behaviors, the OCD stuff that we see, the perpetuation of a previous clinical disease that they may have, schizophrenia. You start using drugs, the symptoms and signs go up. ADHD, the symptoms and signs go up. Depression, the symptoms and signs go up. Suicidal, homicidal ideations through the roof. Criminal behavior increases. I mean, this is how pathological addiction is. And if we have a family system that's extremely pathological, what's going to wind up happening is that's just going to perpetuate from generation, generation, generation. Okay, we call this an intergenerational disease. Okay, I call it the intergenerational alcohol and other drug disease. It is extremely pathological and extremely lethal. So you as the clinician need to take a look at this. And again, as I said so many times, if you see this, don't try to treat it because you can't. Refer this to a family therapist or a psychologist. Okay, family therapists, for the most part, take a look at the entire system. However, there is a difference that you can help. Family therapists see a family systems model. It takes the family system and conceptualizes substance abuse as a symptom of a dysfunction in the family. It's a symptom. It's not the cause. Symptom. I have no problem with that. It is a symptom, but the symptom can also cause a greater dysfunction within the system. Okay. The focus on the family system is more than just including the family system itself, but the extended family system, right? So the extended family system isn't just mom, dad, grandma, grandpa, aunts, uncles, and cousins. No, 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 no. Family systems, when we talk about the extended family, extends to that, but also sociologically, you're going to see where this idea that my wife came, and others have talked about with the post-traumatic slave syndrome idea, is the family system gets extended, right? Yes, you have the nuclear family, mom, dad, kids, and the dog, but now you have the extended family, mom, dad, the kids, the dog, aunts and uncles from both sides. If there's a blended family, you have the initial family, and then you got the blended family that's extended, and then you ready? Society. Yeah, society also becomes part of the extended family to the extent that you interact. Those of you that are into religion and go to church, which I hope a lot of you, but I'm going to leave it at that. For those of you that go to church, you've got a church community, right? So you belong to a club, within the church, youth club, or you belong to the men's club or the women's club, or you belong to some type of sorority or society within that club, and you become very bonded and very close to those members. That's an extended family. You also take a look at society. So in society, you move out and you take a look at what's happening in society, and you have your close neighbors. You have, Barney down the street, who your kids call Uncle Barney because he's so close to the family. That's an extended family. So as a marriage and family therapist, you take a look at all of that, right? Nuclear family, and then the extended family. Now, the extended family, as we see, can also be part and parcel of an extension of the addiction and the problem. So, family interventions begin with the observation of the issue and the recognition of the problems. So, what can you, as a therapist, do? Right? First thing, educate. Psychoeducation is extremely, extremely important. And you've got the tools to it, and you're getting the tools, as you continue your studies. Psychoeducation is really important. Teach them what they're looking at. Make sure you do your research and make sure you understand what you're talking about. The last thing we need is somebody to shoot from the hip and say, "Oh, I got this because I went through this and this is how I got through it." Don't do that. Do not do that, right? Because your experience is not the experience of your patient. This is the danger of countertransference in a session, and this is one of the things that pulls down addictions counseling big time. Okay, and also psychotherapy. But we're just addictions counselors. I want to talk a little bit about that. Okay, if you're in recovery and you're not totally in recovery. In other words, you've dealt with your issues, you've got a sponsor, you're doing the 12 steps, you know what you have to do, you have at least 2 to 3 years of sobriety, if not longer. Chances are, if you got a patient in front of you, when the patient starts talking, they're going to start to trigger things in you. When they trigger things in you, the last thing you want to do is bite that trigger and sit there and buy onto it and say, "Oh, wait a minute, I understand what you're saying because I went through that. Let me tell you what I did." No, you do that, you've just flipped the session. So now you become the patient, and the patient becomes confused, and or the therapist. Patient learns nothing, you learn nothing, session is over. Goodbye. All right. So same thing can happen here. Get your information, understand it, integrate it, and use it. Psychoeducation is extremely, extremely important. Multifamily groups. Your marriage and family therapists do this a lot. You'll have multifamily groups. Let's say, this day and age, we have single parent families. We have families that cohabitate with children. We have families that are married and divorced, and then they get remarried. So you got a blended family. There's a plethora of things that we see in the common world. We call that multifamily generations and multifamily groups. Bring them in. So the therapist will have these multifamily groups, and they're more common in substance abuse treatment, believe it or not, than in family therapy treatment. So the family therapist is going to focus on more of an interfamily relationship, while substance abuse treatment is going to focus on concentrating and helping the client achieve and maintain abstinence. But what you can do with the multifamily groups is you can make it a multifamily or an intergenerational substance use disorder group. So what you're doing is you're dealing with the substance use disorder intergenerationally and interfamilially, so that what winds up happening is that everybody within that family is getting treatment at the same time. So when we take a look at this, we take a look at the process and content of family therapy, right? And the process and content of all kinds of therapy. So generally, the process and content that we do in a session attends more to the process. What is happening between family interactions? Okay, what's happening there, and what has happened in the past. See, some systems, some therapeutic systems sit there and say, no, 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 no. And insurance companies are great for this, especially Medi-Cal. They don't want you to look at the past. They want you to deal with the right here and now. Here it is. Take a look at this, solve the problem, and get the patient moving out into another direction. Okay. In my opinion, that's bad. That doesn't work. Because what that does, it puts a band aid on the problem right now, but then rip that band aid off, and guess what you got? You got blood and you got a scar underneath that. And where does this scar come from? From the past, from intergenerations, from things in the past. So we need to look at that. We need to consider that. And if we can't handle it, again, refer it to the psychologist, refer it to the MFT, refer it to the social worker. But you got to at least be able to see it and recognize that the person's problem comes from the past. So, family interactions. What is that process? What are you looking at? Right? Person comes to you with an addiction. There's a reason for it. There's a dual diagnosis in there. There's a reason for it, right? They come with something. That's probably their coping skill from what they couldn't deal with in the past. So, while substance abuse treatment is usually more concerned with the planned content of each session, we want to be concerned with everything that happens within that session. So the elements of the family as a system is something else to be looked at when we're also looking at complex trauma. So complementarity or complementarily, and that refers to an interactional pattern in which members of an intimate relationship establish roles and take on behavior patterns that fulfill the unconscious needs and demands of the other. What does that mean? When we take a look at complementarity, take a look at how one dysfunction feeds and buys into another dysfunction. Keep that dysfunction alive and well. In addictions, we call that enabling, right? My theory and my process, I call that a functional dysfunction. One dysfunction complements another and builds upon that dysfunction and establishes roles on who is going to move within that system. It establishes roles in the sense that who is going to control that system. It establishes roles as to who is going to perpetuate and bite into that system. And this has implications to it, all of it. When you're looking at substance abuse and you're trying to find the complementarity of all of this stuff, it results in one family member in recovery needing to explore the issues and the problems that got them into their addiction. How that problem relates to the family at large and how that problem evolved over time, right? You have to get the person to look at that, the elements of the family as a system and why they're buying into it. If you don't, then what's going to happen is the patient's going to placate because they're going to be in too much pain. Don't do it the right way, they're going to be in so much pain, they're not going to tolerate it. They'll give you everything that you want. You're going to think you're doing the best job in the world. But in actuality, you're not letting the patient look at and deal with the trauma that they felt. This is why I'm saying once you start to pick this up, refer to somebody that's skilled in this area, and then you get a release of information to talk to that person. You two work in concert with each other. That person can deal with the complex trauma, and you can deal with the addiction, and then together you can deal with the healing. So you remove the functional dysfunction, the intergenerational, the family system, so that the complementarity comes in when the patient starts to change and the family may stay stuck, and that patient starts to move forward, and now the family system has to make a decision, right? Am I going to complement the patient's healing, at which point the family begins to come together and join, and healing takes place? Or if they don't want to deal with that complementary healing, then the family is going to stay stuck in their sickness and their dysfunction while this person is growing, and then you're going to have a split, a break. At which point, this person can never go back to the family system again. That family system has totally annihilated, and this family system over here has to start anew. This is some of the things that the patient needs to explore. What is their relationship within the system? And what is, most importantly, the relationship within themselves? What are they going to buy into, and how are they going to help? Part of this deals with structural theory. Okay, my theoretical basis. Uh, Sal Minuchin. Sal Minuchin dealt a lot with boundaries. Structural and strategic models of family therapy stress the importance of paying attention to family boundaries in that system, right? So, what are boundaries? Boundaries are the delineation of one family member from another, okay? For example, if we take a look at the system, mom, dad, the kids, and the dog, right? The way that it should work is the parents should work in concert with each other to be the head of the household. The children are answerable to the parents and do what the parents tell them to do, right? The parents do not are not answerable to the children, and the parents should never be put in a position where the children tell the parents what to do. That's not how that works within boundaries. Okay, and then you have the dog that's supposed to listen to both of them, the parents and the children, right? Good doggy. Now walk into a family system that has a dog and watch and see who runs the household. It's not the mom and dad, and it's not the kids. It's the dog. Watch it and see what happens, right? To observe it. How many family systems, and those of you that have dogs, you should know this. I know I do. My little baby Toby runs the house. Okay? What happens? Time to go out for a walk. The dog sits there and looks at you. Maybe you got the dog trained for a leash. So the dog picks up the leash and takes it, drops at your feet. That's a signal. Take me out. So you put the leash on, you take the dog out. Dog gets angry at you because you left and you had to go to work. You went to the store and left the dog at home. You come home to a puddle of pee or poo on the floor, right? So now next time what's going to happen? Next time you're going to take the dog with you. And then the dog is all happy. Little things like this. The family system. What would happen if mom and dad that at one point were in charge now abdicate that charge to the child? Or the child becomes a drug addict. And now we have a wrench thrown into the family system. So now the boundaries are going to be violated, and we're going to take a look at how those boundaries relate to one another within that system dysfunctionally. Because now the boundaries become crossed. We call them boundaries, where now the child comes in and tells the parent what to do, and the parent doesn't want to really hurt the child, so the parent enables the child. So boundaries within the family systems, generational boundaries, or boundaries between the families and other systems, regulate the flow of information of of the family systems. This whole regulation or dysregulation of the flow of information from parents to children, children to parents, pets to children, etc. Very, very important. Very important. You know, including the boundaries that happen outside the family, right? What do I mean by that? Well, all of a sudden, Uncle Barney down the street, who's just a neighbor, all of a sudden breaches the family boundary and just walks in. Mom and dad gave him permission. I'll just come in anytime. So instead of knocking on the door, Barney down the street, who had seen his Uncle Barney, just walks in, right? Now, what happens in that family system if all of a sudden Uncle Barney knows that you're home alone and you're an adolescent or a child? Right? Mom and dad are not there, and you're at home. Uncle Barney walks in. You know, hi Freddie, how you doing? It's Uncle Barney. Oh, hi Uncle Barney. You know, and then one thing leads to another, leads to another. Next thing you know, abuse is happening. And then Uncle Barney tells Freddie, "Don't tell your parents what we did because I'm just showing you how much I care. And if you tell your parents this, then your parents are not going to like me anymore. I want your parents to like me." It becomes traumatized at that part because now there's a confusion. Or if you tell your parents what we just did together, I'm going to kill you. I'm going to hurt you. And then you'll never see your parents again. Or I'm going to hurt your parents because your parents just don't understand this. So this is between you and me. This is some really sick stuff. This is also a boundary violation. And this can lead to dissociation. This can lead to complex traumas. This leads to confusion. This leads to substance abuse. So we want to take a look at those boundaries. Ideally, boundaries should be clear. We know step by step who's in charge. Boundaries are also flexible. Boundaries are permeable. All right. Sometimes if we take a look at a boundary, we can go in, we can come out. Right. They're flexible. Rules are there, and sometimes rules need to be bent a little bit to keep things in a homeostasis or a balance. Those are called flexible boundaries, permeable boundaries, where sometimes the adolescent child needs to be in charge of the younger child while mom and dad are at work. Not all the time. Babysitting is fine. Or if mom and dad want to go out on a date night and the older kids got nothing to do that evening, right? Whenever that happens. And mom and dad put the older kid in charge of the younger kids within reason. Right? That's a permeable boundary. It allows movement and communication within the system. However, when we see dysfunctional patterns formed and these dysfunctional patterns become functionally dysfunctional, this can arise from a range of extremes that occur within the system and when the system becomes enmeshed where you don't know where the boundaries are. And when I teach on grounds, I usually tell the students, you want to know how to find an enmeshed boundary? Go into a house and take a look at the bathroom door when somebody goes to the bathroom. If the door's open, they have no boundaries. And in some family systems, that's exactly what happens. Okay. I'm not joking about that either. I'm not trying to be disgusting. I'm serious. In some systems that I've walked into and observed, oh, can I go to the bathroom? Sure, you can go to the bathroom. And then, I'm going to go into to grab a glass of water or something. And all of a sudden, I take a look and the door's open. I'm not going to look into the bathroom. I don't need to see that. But what I do observe is the door's open. Right? And that happens. Or mom and dad are in the bedroom and mom and dad are doing whatever they want to do. And all of a sudden, instead of going and the kid knocking on the door, they just barge right in and see whatever they see. That's a boundary that's being crossed, right? Boundaries can also be uh, disengaged. A disengaged boundary is when there's a lack of cohesion needed to hold the boundaries together, right? Disengagement is pulled apart. Are no real boundaries. Nothing is holding anything together. Dinner's at 5 o'clock. The kids come in at 7 or 8 o'clock. Mom, where's dinner? Oh, here you go. I'll cook you something right now, or something like that. Or mom and dad's boundaries aren't together, and they have no respect for each other. It's disengaged. It's disconnected. It's not there. There's lack of cohesion, lack of things pulling it together. Boundaries, when they are weak, when family members experience this, they become psychologically and emotionally tied together and meshed, or they lose their ability to act as individuals within that boundary. And the entire boundaries, the whole system within that boundary system, falls apart, and the display in that system is horrible. However, as we look at a family and the system and the boundaries within that family, we also see things within that family called subsystems. Now, subsystems within a family system, uh, are separate. They're clearly defined. They're boundaries that fulfill particular functions within that system. They have their own rules, their own regulations within that system. And a good example of this is a healthy family where you have the parental subsystem, mom and dad at the top, right? It can be made up of one or more individuals, mom and dad, or you know, in the gay and lesbian community, maybe two males or two females is acting as moms, dads, that type of thing. It gets a little bit hairy when we have blended families, right? Divorced, and then those two get together, and you have now two parents, two moms, two dads, within subsystems. That gets to be a bit complex at times. But when you have a intact family subsystem, there's a degree of privacy. We know who the responsible parties are. We know that responsibility can be spread out to the elder children and to other children, right? Provides the family a good power structure, right, to make decisions. within that system. Subsystems have rules. Some systems have regulations, have expectations. They can be strong. It can impact behaviors within that system very positively or negatively. But subsystems aren't necessarily always nice. Subsystems can be a ruling faction, or it's totally a dysfunctional that rules the household and causes much disruption within that. Regardless of the situation, what happens, subsystems have a tendency to have an impact on the client's behavior, right? It could be used to motivate, it could be used to influence, it could be used in a positive direction, but as you observe it, it can also be seen as something that takes away from the functionality of the patient, can be seen as extremely dysfunctional. Now, how do we, when we're looking at a family system, how do we see the functioning of these boundaries and the functioning of the system? Well, we take a look at how it holds and how it stands over time. This is called endurance. So, how these ties between mom, dad, the kids together, the kids within the extended family system, and they're tied together and linked together, how do they endure? Another important thing that we need to take a look at is that families are connected through more than just physical proximity. We talked about more than just mom, dad, and the kids, right? You have daily interactions, community interactions, strong emotional ties that connect family members to people in the extended family or the outside family or the communal family, even when they're separated, right? And this is how they get. And I'll tell you something very personal for me right now, right? Over the course of my marriage, right now it's been 27 years, right? We've had six dogs: Hepzibeth, Nyota, Jane Francis, Osa, Nia, and now my little boy here, Toby. Right? Six dogs. Five of them have passed away. The only one I have right now is Toby. There's a big hole in my heart, and I miss my babies dearly. Okay, it's been years, and you may say, Doc, they're only dogs. No, they're family, extended family, but they're family. I love those dogs just as much as those of you that have children love children. Now think of it as what happens if one of your children dies. What are you going to feel like? It's the same feeling that I have because my five babies are gone. So I want to stop that because if I don't, I want to start getting emotional. But anyway, when we see that, we see the connections that we have with family members or extended family members, or even when they're separated from us. The memory is still there. The memory keeps. For those of you that are of age and your parents have passed, and you're there, with your family or alone, whatever it may be, you're still connected. You still keep them alive, and that can be good or bad. Because the enduring family ties can be extremely dysfunctional within the family system if it's an abusive family system. If you are enmeshed within that system, and we take a look at that connected system, and that connected system is a system of abuse, and we see that your behavior, the addictive behaviors, maybe prostitution, maybe self sabotage, low self esteem, poor self image, part and parcel of that dynamic that happened within that family system or extended family system that we are connected to and can't separate from. And as long as we are connected to that system, not separated from it, the perpetuation of that dysfunctionality will continue. But we need to address that as counselors. We need to look at that, at the family loyalties. We need to look at the systemic loyalties that continue to shape our behavior. How many times have we said, "Oh my God, my father was abusive"? If you're a girl, father was abusive to me. I will never marry anybody like my father. Or you guys, oh, my father was abusive. If I ever have a family, I will never be like my father. Right? So you young ladies marry somebody, and who do you marry? Marry somebody with the same pathology as your father. So you've married your father. You guys, right? You marry somebody, you have kids, and you discipline your kids, and you wind up looking back after you've disciplined your kids, smacking yourself in the head, saying, Oh my God, I'm just like my father, right? But that's being shaped, that behavior has been shaped by the loyalty of that behavior, right? Those issues. So we need to take a look at that as counselors and point that out. This is why, in some situations, sometimes marriages break up, and sometimes, in the addiction world, I mean, I've been through this with my patients, where it's been recommended that they just go their own ways, and the moment that they split up and go their own ways, that functional dysfunction breaks, and then you deal with the individual patients. One goes to another therapist, and you're dealing with the other patient, and you reshape that behavior, and you address these issues that I'm talking about, these loyalties. Once that happens, detachment occurs. And if appropriate detachment occurs, then you can start shaping a new behavior to have a functional dysfunction become a functional function. This goes all the way back to family of origins. But with regard to treatment, it is possible to involve a client in a form of family therapy, even if the family members are not physically present in the session. But that session has to be focused on the family system, how that system works, not the individual, because the individual is part and parcel of that family system that's been embedded. Once you look at that system and you get the patient to see how their behavior functions, it functions because of that system and in spite of that system. Once they learn that system, they now make a decision and a choice either to stay within that, remain dysfunctional, or to remove away from it and learn something new. It's called change and balance. So we need to take a look at the family rules and the family scripts, or the scripts are the things that make us who we are. If we have ever watched a movie and the movie flows just beautifully, right? And we sit there and we say, wow, look at this. It's almost like being there. Well, the actors aren't doing this impromptu, right? The actors are following a script, a written thing that they talk. For example, somebody may sit there and say, well, Mr. Vitti, uh, so you're having problems here that are sexual in nature, aren't you? And Mr. Vitti sits there and says, "What are you talking about?" Well, you just told me that you can't get it up. Oh, you mean sexually? Oh no, Mr. VD says. No, I can't get it up because the game between Harvard and whatever, right? It's scripted. It's written. That's what it is. Well, we have what's called life scripts, and life scripts are there because of the family rules that we live. They're unchangeable, locked. They exhibit different degrees of adaptability, right? Who rules who does what. And when we're faced with the need to change, or when we have patterns of behavior that change, right, which happens throughout, then that script, that balance gets thrown off kilter. Balance is called a homeostasis. When we go into an off balance, that is called a disequilibrium. Okay. So when we have a family that is in disequilibrium, it needs to go into an equilibrium or a balance. And to do this, we need to take a look at the rules and regulations that the person grew up in. And we also need to take a look at the scripts that the person is living with. These are called life scripts. When you face that, when the patient starts to face that, this is where healing becomes, because now there's a choice that they have to make. There's a tendency in all families, for a balance, for that homeostasis, for that equilibrium. The balance needs to be strong and structured. But within that system, we have competing forces that tend to resist change, right? We call this in the addictions world a codependent relationship or an enabling behavior. These two forces that act within it try to keep a balance, a functional dysfunction. This has to be overcome. Change within that system, in order for the patient to change, has to occur. Walsh in 77 turns around and says that families need to be able to uh, preserve order and stability without becoming too rigid or adaptable, right? Flexibility within that system is an important quality for a high functioning family. It has to be flexible. It can't be rigid, my way or the highway, because that, if you have a rigid household, just think what can happen, right? You have a rigid household with kids. I want you here at this time. The kids are going to be no. There's going to be a lot of argumentation. So rigidity doesn't really work. Flexibility works, but flexibility within reason and within boundaries. And how do we get flexible boundaries? Through interaction, interpersonal interaction, and talk. Mom and dad has to talk to the kid. Kid has to talk to mom and dad. Feelings have to occur and be exchanged between both of them, and they both have to be respected. My way or the highway. That doesn't work, right? In a family system. Yes, there's discipline. I don't want the kids to walk on the parents. Discipline has to happen, but how is that discipline dictated? Discipline doesn't have to be beating the kid. Discipline doesn't have to be cursing and swearing at the kid. Discipline doesn't have to be inappropriate scripting, right? Like the example I gave with Paul Vitti and the psychologist. That doesn't have to happen. What has to happen is flexibility. So I don't want you to go see this person. Why? You just don't understand, mom. Well, let me explain it to you. This person is not really a good person to be with because they do this type of behavior and this and this and this, and this type of behavior, if you do it, can lead to X, Y, and Z. uh, you know so the kid responds back, the parent responds to the child. You're angry right now, I understand that, but unfortunately I'm going to have to hold strong to this, or else there are going to be consequences. And you don't just say these are, there's going to be consequences, because the kid's going to sit there and say, yeah, what are they? There's going to be consequences if you do this, and this is what the consequences are going to be. Be clear, delineate, and sit there and enforce. If something like this happens in a family system, and the parents put a rule in place and they don't follow through with the rule, you've just set a precedent. Precedent, the kids gotcha. And now you've just taken a homeostatic balanced system and you've unbalanced the system. So now that rule gets tossed out. There is no flexibility. It's a new rule. I hope you see what I'm saying there, right? So too much flexibility leads to chaos. Not enough flexibility leads to disorientation, dysfunction, chaos, and disequilibrium. So there has to be a flexible balance in there where open communication between all parties is involved. So families that have members who abuse substances are more likely not to be flexible, but to be excessive, right? You got to do this, you got to do that. Uh, Leave me alone. They get beat, they get hit, right? In a family that's organized around substance abuse, the tendencies toward balance or homeostasis means that other family members, in a misguided attempt to prevent disruption in the family, can enable and can continue abuse and keep that person using substances, and not get them to abstain. Right? Yelling, screaming, tightening the boundaries, go to your room, do this, do that. How dare you? Yelling at the person, putting ungodly rules and regulations on the person, not listening to why that person is actually using. Because that functional dysfunction isn't necessarily because the kid's hanging out with a bad kid. The kid's hanging out with a bad kid because the family system has been so distorted. Now we know that at a certain age, especially in adolescence, and those of you that have studied adolescent psychology, you know this well, right? That when during the adolescent period between 13, make it down to 12 and 21, 22, the brain is still not well developed, especially the frontal and prefrontal cortex. Frontal and prefrontal cortex of the brain is the seat of executive functioning, decision making, emotions, along with the thalamic region, the hypothalamic region, and that area that deals with all of the moods in the center of the brain. that area of the brain. When we take a look at this, let me put it to you this way. Let's make it easy for you. Okay, here's your brain. Okay, I'm talking about this part of the brain up here, right? The frontal prefrontal cortex of the brain. This is your executive functioning right up here. Okay, in adolescence, this part of the brain is not fully developed yet. So the brain is in a bit of a disequilibrium and imbalance. So the child's going to think that everything that they're doing, the adolescent's going to think everything that they're doing is correct. Okay. Now that part of the brain is connected to the central part of the brain, which is connected all together. The brain can never come apart here. I will show you what I'm talking about. There you go. This part of the brain here, right? This is called the limbic system. So you've got your frontal cortex, your prefrontal cortex, and then over here you have your limbic system. So here's your executive functioning, and as you can see, it's connected to your emotions, your emotional system, right? The corpus callosum, this large thing over here, the fornix, the thalamus, the hypothalamus, and this is your pons, and your medulla oblongata is attached back in here. That's the medulla. Okay? But this is your seat of emotions over here. This is your executive functioning over here. What happens with adolescence, this is not, the connections over here are not fully developed yet. And that finally gets in shape about age 21, 22, believe it or not. Okay. So when an adolescent comes to you and they start, oh, parents are the dumbest thing in the world. This is what's happening. Now, during this time, a lot of modeling has to happen with the parents. So the parents have to model and have to start to shape the adolescent behavior. And the way to do that is through boundaries, through teaching, through education, through understanding, through doing exactly what I'm talking about here. To understand, right, that during this age, it's a very permeable time. And if the parent is too rigid, right? The child is not going to be able, the adolescent is not going to be able to understand that rigidity, nor the reason, because the reasoning section in the brain, the prefrontal frontal cortex, is not fully developed. So the adolescent can't really reason appropriately. They can reason, they're starting to make the connections, through education, through social interactions, through everything that we do. But at the same time, it's not fully connected. So unless things are explained over and over and over again with patience, the functional dysfunction is going to continue, right? So this can be seen as abuse. Now, take that system, that rigid system, and add to that physical, sexual, emotional abuse on the child, on the adolescent. Now, what's going to happen when the frontal prefrontal cortex starts to get connected to the limbic system, right? That gets totally confused. The neurotransmittal system in there, the things that make us happy, mad, glad, sad, right? And you learn about those in physiology and pharmacology, right? Neurotransmitters are going to have messengers, right? That are going to send signals to different parts of the brain, and they're going to be dysfunctional signals. I believe that the ribonucleic acid, the things that starts to send the messages, the RNA, you've got something called mRNA, messenger RNA. Is also part of what they use when they make vaccines for viruses, right? Messenger RNA. What it does, it sends it to the messenger sends a certain signal to the RNA that sits there and says mutate into this body so that the disease, the virus that there can be destroyed, can eaten up by it, right? And you use the same type of virus. Um, you take the virus that you have, you create a messenger RNA from that virus because you're taking the RNA from the virus and the DNA from the virus and you're mutating it. The messenger signal goes into the system, and this is where we have to have the vaccine. And this is how the body builds an immunity, right? The same thing happens cognitively. If you've got an adolescent in a dysfunctional family system, well, that message to the adolescent is stay dysfunctional until it changes, as I'm talking about here. So families need to find ways to accommodate a person's substance abuse and perhaps gain something from that abuse. In other words, I don't mean accommodate in the sense of allow the child to use. No. I mean, accommodate in the sense of trying to understand why and what the purpose is, and then try to start to work on a healing process. So your job as an addictions counselor is to find out what that functional dysfunction is within that family system, see the communication lines in there, to try to understand if the transmission from the family system to that adolescent has been perpetrated by a functional dysfunction, which is perpetuating the addiction. If you can do that, oh my God, the healing process can actually happen. Because if it doesn't happen, then what's happening through the addiction and also through the irrational family system is that adolescent is becoming more and more dysfunctional, more and more traumatized, and then you see how complex this becomes. It's horrible. So what happens in that system is they develop a pattern of accommodation and ways to cope with substance abuse, keeping children extraordinarily quiet or not bringing friends home, rigid boundaries, right? Family members try to restore a balance and maintain a family balance, right? So we have to try to do that because we need to accommodate. We need to work and sit there and say, no, you can't bring this person home, right? We may need to take the boundaries and make them a little bit more rigid than what they are, right? Don't bring this person home. Not good. Not welcome here. But don't just say that. Say this is why, right? When we talk about disciplining children, it falls right in here, right? Because this is where it begins. A kid does something wrong. When you do a discipline on a child, that discipline has to be measurable, has to be reasonable. For example, Susie, don't touch the stove, you're going to get burned. And mom walks away. Next thing, mom hears a scream. You know why? Because Susie touched the stove. Now, let's take that same scenario. Susie, don't touch the stove. If you do, I'm going to cut your fingers off. Mom goes away. She hears a scream, comes back. Why? Susie touched the stove. Now we got a problem. What's mom going to do for discipline? Take the cleaver and cut Susie's fingers off? I don't think so. But she also can't sit there and say, I told you not to do that. What's the matter with you? Because now Susie's going to understand if I touch the stove, I still have my digits. Mom's not going to cut my fingers off. So now I can get away with things if mom tells me something. It's that simple, but yet that complex. So if you're ever going to do a discipline, it has to be measurable, it has to be reasonable. Susie, don't touch the stove, you're going to get burned. And if you do, then you're going to get a timeout. Mom goes away, the scream happens, goes back, what happened? My fingers are burned. Okay, so mom takes care of it and says, okay, Susie, go to your room. No, no, give me your phone, no cell phone, no TV, go to your room. Kid starts crying, go to your room. Kid goes to the room. 15 minutes later, mom calls the kid down. Susie, sit down over here. Tell me how you feel right now. Mom is listening. I feel bad. What is it that makes you feel bad? I didn't listen to you. Well, what did you do? Well, I went to touch the stove. Oh, so you went to touch the stove. And what happened? You did what happened to your hand? I burned it. So you touched the stove and mommy told you not to touch the stove and you burned your hand. Do you like being burned? No, mommy, I don't like being burned. What did you learn sitting in your room for 15 minutes without anything? What did you think about? That I shouldn't touch the stove. Anything else? Well, that I should listen to you a little bit more, mom. Very good. I appreciate that. That's right. I want you to know something, right? Mommy loves you very much, but mommy doesn't love what you did. So mommy will always love you, but mommy may not always love what you do. So when I tell you not to bring Freddie home because Freddie's not a good person, you may think that Freddie's a good person, but what's mommy actually saying? Mommy is actually saying that she knows a little bit better, and I'm going to explain to you why. That's what this is talking about, right? This is where you try to restore homeostasis in the family system. This is where you don't just say don't do drugs, right? God bless Betty Ford. But to sit there and say, just say no, I'm sorry, doesn't work because there's no explanation to just say no. And to just sit there and say to be a good boy or a good girl, that doesn't count either. You've got to give a reasonable, understandable reason why. This is why we have family therapy. Family therapy is a system that you need to get used to refer people to. It's a system, and in any system, each part relates to other systems. This is what family therapy looks at. Family looks at the family systems and their interactions. What change in any part of the system, as I say always, ever will bring about change in all of it. Therapy is based on that point of view. You change one part of the system, the entire system changes. If it doesn't change, then the problems will exist and the system will fall apart. And that's not what you want to happen. So, family therapy and substance abuse has two main purposes. First, it seeks to use the family's strengths to resolve the issues, to help find or develop ways to live without substance abuse, and it also tends to get rid of, to ameliorate, to obliterate the impact of chemical dependency on both the identified patient and the family system. You know, it's a process. It takes time, right? Um, it marshals the family strengths. It brings about the family strengths. It draws on the family strengths and tries to make the weaknesses of the family into the family's strengths. It requires a lot of provisions, of basic family support and family solidarity. The family has to understand that. So marriage and family therapy, as you will learn, started in the 1950s. It had a system that focused on the previous understanding of the family in family therapy. Reach the family and individuals within that family. The person that has a substance abuse is regarded as a subsystem within that family system. The person who has that addiction, who has that subsystem, has severe repercussions throughout the family system because that can offset that family system. The relationships in that subsystem are therapeutic interest with the family therapist and with you, the addictions counselor. Because in one theory, systems theory, how this whole functional dysfunction works, how this family system works, right? It recognizes that a whole system is more than the sum of its parts, right? This is if you want to look at a systems theorist, take a look at um, Fritz Perls. Fritz Perls was big on this, right? But Fritz Perls in Gestalt therapy took a look at a system, took a look at and saw the person as a whole person that has parts attached to it. And some of these parts within that whole, right, are dysfunctional or off kilter. So the idea is to look at each part of the system and make them fit so that the parts of the system are healed. And as you look at the whole system, that whole system makes a unit. And that unit is functionality. So parts of the system are interconnected with other parts of the system, right? So that functionality, right, works together. It determines how the system is going to work. They're dynamic, which means they're constantly moving, carefully balanced, which means they can be carefully unbalanced, but they're always changing. The only thing we know for sure in a family system is it's always changing, right? So promote guarding against system entropy or disorder and chaos within the system is very powerful. And it's this part and parcel of what you're going to do as a counselor with the marriage and family therapist is going to be to work in concert with you and or the psychologist to work in concert and or the psychiatrist to work in concert. Because when doing this, you've got to change the roles of the family system, which means sometimes the family system's rules have to change as well. Okay? So, as we take a look at this whole systemic issue of the family system, the family dynamic, first of all, I want to thank you for putting up with this. I'm, at this point, but this is extremely important for you. Right? Understand the dynamic of the family system, understand boundaries, understand where it comes from and how it goes, and your part in it. Treat, to open up, and to refer, to refer, to refer. I'm going to be saying that forever because as an addictions counselor, your job is not to treat that, but to recognize it, to understand the symptoms and the signs, and to be able to say, this is what I'm dealing with. To do excellent clinical notes and then make a referral the appropriate way through the release of information, etc. And then to be in contact with that therapist so that you two work together so that that therapist can work on the restructuring part and you can work on the fixing the addiction part. This is how psychotherapy works. This is how addiction counseling works. Okay. So thank you very much for your time and your patience. Thank you very much for being in this class. And again, I would like some feedback on this if it was worthwhile. I hope you get something out of it. Ask your questions, drop them off in the forum. I'll be more than happy to answer them to you, as several of you know. Send me an email if you wish, if you're comfortable that way. I may take that email and cut it and paste it in the forum and say, this is what this brilliant student had said, and this is my comments to it. Right? I want you to get to understand this material, really learn it. This is going to be one of your key classes in your career. All right. So thank you for listening. I appreciate it. Take care, and I'll catch you on the flip side. Bye.